Hi, you guys. Happy New Year, I guess. I hope you guys' New Year is going well so far. If you are new here, I'm Miss Preppy Pearl and I do all forms of content, but I focus right now is on my Health Informatics series. For those of you who are already subscribed, thank you so much for continuing to follow me and to engage with my content. I really appreciate that. On that note of engagement, I've been noticing so much engagement, so many comments, so many questions regarding this series and just health informatics in general. And with that, I noticed there was a lot of common questions or themes. So over the next few weeks, I'm going to kind of address those questions. So if you are interested to learn about health informatics, if you are interested in pivoting, if you are just curious to just see what is out there in this field, or if you're interested in like how my journey was in health informatics, please continue to watch this video and also take a look at all my previous videos in this health informatics series. They are definitely helpful and beneficial, and it might be able to answer some of the questions that you already have regarding health informatics. But with that, let's go ahead and get into the video. And I know once more, I just want to say thank you to everyone who has again been supporting and just really making me feel like, yes, this series is important to people out there. And so yes, now let's go ahead and get into this video. So over the past few weeks, as I've been like looking at the comments that have been coming in from some of my videos, one question that I kept seeing over and over again, or one thing people kept on asking me is that, hey, Miss Preppy Pearl, like I have a background in this. This is what my bachelor's was in. Do you think it's okay, or can I transition into health informatics, or will I be able to be in this field? And with that, I kind of want to start with my journey. Again, I kind of touched on this with some of my previous videos, but my bachelor's was in neuroscience, so completely different from health informatics. Health informatics is focused again on that data tech analysis side, and then my neuroscience degree, which is what I got my first degree, bachelor's, it was neuroscience, so biological sciences. Of course, we did a little bit of like statistical analysis and maybe analysis of data, but it was not as heavily data focused or health focused. So with that, that should hopefully answer the question of, can you be in health informatics if you have a background in a completely different field? Yes, the answer to that is yes. I know I noticed some people were already in certain health related backgrounds. And so for people who are coming from a health related background, but not specifically health informatics, I definitely think it is much easier for you to transition to health informatics, and for a couple of reasons. One, you are already familiar with the healthcare landscape. So whether this is a private healthcare institution, a hospital, public sector, but it's in the healthcare space, you kind of already understand the clinical workflows. You kind of already understand how the organization runs when it comes to patients. And you also have the background of you have to protect patient information. So most people who are in the healthcare field, actually all people who are in the healthcare field, we have to follow HIPAA. And so with that, we also have to make sure that the data, patient information is being protected and secure at all times. So because you have a healthcare background, you will already be kind of like ahead of the curve, and it will be kind of easy for you to understand health informatics. With that, I would say that with the background that you have in healthcare, it's depending on a couple of things. So again, with my background, neuroscience, and then I had a minor in health and medical sciences, I was kind of already privy to understanding like healthcare, understanding things that were occurring in healthcare. And so when I looked at data, it wasn't too foreign for me to understand, because when you can kind of translate what's happening in clinic with the data, it's so helpful. So again, anyone with a clinical background or a healthcare type background, so say you're a CNA, you're a provider, you are just anyone with a healthcare background, pretty easy to kind of get into health informatics, or say that you want to go and pursue a master's in health informatics. It's pretty easy to do that because of the fact that you already have that background. So that is for all of my healthcare and clinical background folks. For other people who are not coming from a healthcare or a clinical space, it's a bit different. So someone mentioned in my comments that, hey, like I'm finishing up my like logistics and supply chain degree, my bachelor's degree. Do you think that I'll be able to like get into health informatics and whatnot? And again, with that, I have seen, especially in this field, I have seen people from all backgrounds. So whether it is law, whether it is anthropology, just any type of background you will find in the health informatics space. What is important with the background that you have is how can you translate that or transfer the skills that you've learned into health informatics. So for the person who mentioned that they are getting their bachelor's in supply chain and logistics, that is honestly such a great thing to get into health informatics if you want to go from like the process improvement side of things, so the industrial engineering side of things. There are a lot of projects related to health informatics that you will have to apply some of that logistics and that supply chain piece into the field. And so I always tell people, if you are looking to transition into this field and you see that your background is not specifically healthcare focused or even data focused, sit down and look at all of the skills that you have acquired in that field and see how they can translate into health informatics. And I mentioned health informatics to you guys. It may seem like it's niche, but it's not. Health informatics is very broad and there are many things you can do in health informatics. And so because of that, I always tell people, you don't have to follow my path because again, the path I wanted to go into is completely different. But if you see that you are more privy or you're more skilled in something, lean into those skills and find how you can fit in health informatics. There are so many job opportunities, so many things that fall into the health informatics bucket. And so with that, you just really have to go out of your way and research what those things are. That kind of concludes everything that I wanted to discuss and share regarding, can you get into health informatics with a different background? Yes, you can. Some of you asked that, okay, I got this bachelor's, will I be able to get into master's of health informatics with my background? And again, it all goes back to what I said previously. Just show that you have the skills needed in order to be successful in this field. You do not necessarily have to have data experience. I know when I was starting my health informatics journey, again, I was coming from neuroscience. I had no real data experience. I had no real tech experience like that. And so for me, I was just like, okay, how can I make sure that I am marketable for this degree? Because a lot of degrees, a lot of programs, what they do is that they want to see what other skills you've acquired. And again, they're seeing those skills so that you can apply them in the program. And so if you're looking at a program and you're trying to pursue a master's in health informatics, go onto their website and look at what are the requirements or what are the things you're going to be learning, and see how you may have also already done that with your background, with your bachelor's, whatever it may be. Actually look at it and see how they can kind of coincide in that way. As always, the biggest thing when it comes to health informatics, and maybe it's because of my research background, always just research, ask questions. Do not be afraid to ask people questions. Until they say no, keep asking questions until you understand or until you find what you're looking for. With that kind of is what I wanted to share in regards to, can you enter into the health informatics space? Can you get a master's in health informatics despite whatever background? You definitely can, and I would actually encourage it because honestly, we need different perspectives and different skill sets to really understand how to help in the informatics space. The only thing with all of this that I've mentioned, so whether you come from a non-clinical background or a clinical background, is that health informatics is healthcare. And so because of that, I always tell people, if you do not have the passion to truly help patients or help healthcare organizations, this may not be the field for you. I always say that not everyone is meant for healthcare, and I don't think everyone should be in healthcare if they don't actually have the passion to be in it. If you're trying to pivot or whatnot because of the money, I don't ever like that avenue. I don't really encourage that type of mindset because, again, money can only do so much. And on top of that, I feel like what happens is that when you're in the healthcare space, you will soon realize that things truly are not about the money. And so I will say to everyone out there, if you're trying to enter the space, please have the heart and the passion for healthcare. Have the heart and passion for improving people's lives. Even though we do deal with the data side of things, the things that we use that data, the way we analyze that data can be used to impact the lives of patients, so our end users. And so really sit down with yourself and think about whether this field is for you, because this field, it's not necessarily tough, but it will challenge you. It will require a lot of perseverance. It will require a lot of patience. And so if those traits are not things that you really see within yourself, again, reevaluate what you really want. And so, yeah, that is all I want to say and end on for this video. And with that, I will say see you next time. And in the meantime, if you have any questions, please let me know. Drop a comment below, and yeah, let me know. And yeah, I'll see you guys in the next video. Thank you so much for watching. Bye.